So I'm Nicky Turner. I'm the Band 7 acute oncology nurse at Worthing Hospital, and I look after acute oncology admissions, but also patients who are diagnosed with the cancer of unknown primary. So I worked in the clinical trials department at Worthing Hospital for about 7 years, about 15 years ago, looking after patients and recruiting patients into urology, oncology clinical trials, which I really enjoyed, and it was really great to be on the edge of changing medicine, changing practice, and even now looking back, the trials that I was in and recruiting to have changed, opportunities and treatments for patients over the last decade. It was really an exciting opportunity. And then I left there to set up the acute oncology service here at Worthing Hospital about 14 years ago. So as part of my job role now, it's looking after patients who are diagnosed with a rarer type of cancer. So it's about 5% of cancers, cancer of unknown primary, which is a histological diagnosis of a malignancy and oncological cancer. But the primary site, despite radiology and biopsies, the primary site can't be identified. Having been in the research department, I know that there's lots of trials for lots of different tumour sites, and what I did find when I started looking after these patients is that in terms of their prognostic outlook, it was quite poor, and in terms of treatment, there was generic treatments, but it was quite difficult to tailor treatments for these patients, and there didn't seem to be any very significant clinical trials available to these patients to improve either their overall survival or diagnostic pathway to kind of tailor their treatments more appropriately. So I was interested in the fact that there was this big gap for this particular cohort of patients as far as I could see it. I heard about this clinical trial at Brighton run out of the university that was using artificial intelligence to read the genome, and they're setting up a clinical trial specifically for cancer of unknown primary patients. So that piqued my interest, and then the opportunity to apply for the research fellowship was advertised, and feeling the way I did about these kind of opportunities and the patient that was really underrepresented group, I thought this was a really good opportunity to see if I could explore it in a bit more detail with a bit more time. It's been really interesting. It's been really informative. I think it's really opened the world even wider to understand, what's outside of my local kind of knowledge. So it's been a really good opportunity. It's also given us, or certainly myself, time to look much more in depth at the cohort of patients. So with the 1 day a week, you've got that time to read around your subject, look into, do your literature searches. So it's just given such great opportunities, and the support is amazing. That's been really supported by my manager. So I have an agreed day a week that I'm allowed to take as my research day. So it's been really helpful. So it's all agreed in practice. So it's not really been problematic at all. I just wish I could have lots more time. That's all, isn't it? It's just never enough time. I think it's an amazing opportunity, and we should all be interested in evidence-based practice and research. So I think if you have the opportunity to apply, you've got nothing to lose. I really didn't think I would qualify, but it doesn't matter what level of staff you are or what grade. I think having the opportunity to look much more in depth at a subject you're passionate about is such a great opportunity. I'm really passionate about research, and I'd like to kind of champion research within my clinical role and within my clinical practice.